Good morning, Dr. Quinn.
Hey, good morning to you.
So, the last time we spoke, we actually were talking about this very topic. And I guess the question that comes into the top of my head is a lot of people who work in senior health facilities, they typically wear masks, but for some reason the virus is still being transmitted among the seniors and among the people who work there. How is that possible if people are wearing masks?
Well, the deal is the masks are very, very helpful, but they're not 100%. And the problem with nursing homes is the fact that I actually used to work in a nursing home as a medical assistant before I was a doctor. And I would go out and get lunch for everyone and return. And what's happening right now, one of the main reasons COVID-19 is so deadly is the fact that a lot of young people, which I was a long time ago, they don't have symptoms in a lot of cases. So they may go out and get food and come back, and they may be a carrier, but asymptomatic. And when they're caring for the senior citizens like I used to, you might have to bathe them, roll them over, change their bedding. You have very close contact, very hard to social distance. And that's a big opportunity for spread of this virus. And in a lot of cases, that's what's going on right now.
And so would a face shield help on top of the mask?
They would help. I mean, anything we can do to increase the barrier between, persons caring for the patients and also visitors would be good. But also know that in the United States right now, there's a severe shortage of personal protective equipment. A lot of times this equipment is not available, and that's what's going on right now. But the bottom line is we just have to be aware and do everything we possibly can.
And so Pfizer is coming out with a vaccine. Would that be safe for seniors to take?
Well, the good news is, and I did a story earlier this week, the research is really looking promising. And as far as the side effects or the dangers, the bottom line is that the research is showing that the risks are much less than the benefit potential, meaning that this vaccine is looking good, and I think it's going to be really good for these senior citizens and all the other vulnerable people and just the world in general.
Okay, that's great. That sounds good. And is there anything you'd like to add that I haven't touched upon?
Well, just want to add that it's something we should really take seriously because a lot of senior citizens are losing their lives. These are the more vulnerable population, the seniors, older, chronic medical conditions. These compromise the immune systems, and that's one of the main reasons why a lot of our seniors are losing their lives, because they fall into this category of the most vulnerable population.
All right, so do everything you can to help the vulnerable population. Wear your mask and make sure you sanitize your hands. All right, thank you, Dr. Quinn. We'll be right back after this break.
Thank you.